Okay, so now, we've been talking a lot about the kind of the forearm, wrist, and hand, and so we can go through some of the common diagnoses of those. Again, inspection is so important. We look for swelling. If you have what's called de Quervain's tenosynovitis, you'll see swelling here. If you have basal joint arthritis, you'll see bulging here. If you have a torn radial collateral ligament, then you'll see a resting deviation of the thumb, and it's very prominent. If you have some arthritis or tenosynovitis of the big extensor tendon through here on the ulnar side, that'll be prominent. A ganglion cyst, of course, sticks out like a big, goose egg there on top, usually most commonly right here. We look for atrophy, very important. We were talking about that before. So if I look at your hand, there's 3 places that I look for atrophy. I look over here, and I see that that's plump and not flattened out. What it'll do is it'll look like a gaunt, face. And then over here, I look here. This also can develop an atrophy there. I had a young woman a long time ago, had never been reported, who had traumatically, very active athletic person, had traumatically torn off that first dorsal interosseous muscle. So she didn't have a nerve problem. She tore the insertion right off of there, which is what gives you that strength there. And so she had just already atrophying. This was at 4 weeks, it was already atrophying. So I reattached it and it came back, it's fine. Then, and very importantly, looking at the thenar muscles. We want to see a nice, plump, convex surface. If it starts to flatten or even just be soft when you palpate it, then we worry about the nerve, not enough nerve signal going to that and developing the early atrophy. So we look at that, we look at the rotation. So again, we've inspected. I'm not going to test strength yet. I'm going to look at rotation, wrist and finger motion. So we look at the full pronation, full supination, very subtly between individuals, but more or less we're looking for 90-90 of pronation, supination. And then we look at the wrist, and we want to see that you have roughly, that can vary a lot, but somewhere between 70 and 90 of extension and 70 and 90 of flexion. We want to know if that hurts or if we feel crepitus, that crunchy feeling that can indicate inflammation in the joint. Similarly, when we're pronating, supinating, we're feeling for inflammation there. If you walk in and you have a very prominent distal ulna, especially asymmetrically, that's important to me because, and especially if you had a traumatic accident, these are commonly missed. There's some thick ligaments here, the DRUJ ligaments, and those can allow the ulna to rise and the radius to fall away from that. And it's very disabling, especially for athletes. And so I see it in hockey players who take the slam. And so I'm checking that and looking for that stability there as I rotate and watch it. So we've looked at range of motion. Now for the thumb, this joint right here, the MCP joint, where you have a skier's thumb for the ulnar collateral ligament and a radial collateral ligament tear, though that's the most variable joint in the body in terms of varying among individuals. So you have a minus 30 passively, and you flex nicely down to about 70. We look at my thumb, I hyperextend a lot more, but I only flex down to about 40. And that's just, everybody's different. So we want to compare the two and see. And especially on laxity, even side to side, if I'm testing this and you have a tear, it'll go way over sometimes to 60 degrees, 70 degrees, either direction. We know that's asymmetric and that's not going to withstand and need to be repaired. Fingers, we want to just simply see if you can make a tight fist, which you can. You can really nicely curl those fingers down. If you've had various injuries, that's going to be altered. When you straighten them back up, if one of them stays stuck down, then you probably have a locked trigger finger, and I have to pry that open, and then I feel and palpate. I feel a nodule. I feel the swelling in the tendon, the tenderness, and then we know that's what you have. It's very easy. Now, next, we need to remember that for a lot of overuse strain, whether you're a professional musician or working out in a gym regularly or irregularly, more commonly, there's 2 sites where you can get the most common injury, and you know this in spades, is the musculotendinous junction. You talked about the eccentric loading, and there's 2 spots for that. There's one right here, and there's one right here. There's these short tendons that attach to the bones up here, and you can get the muscle tendon junction injured there. And you can get where the tendons become the long tendons and the muscle, that that transition zone. And those are the two places. So we're going to test those. A lot of patients come in and say, I'm having pain here every time I try to work out or play tennis or whatever, or here, and so that's what we're feeling for. Now, I can test this. You pull up against me hard, it's rock solid. Pull down against me, down this way, hard, and that's great. We have your thumb pull up this way, it's super strong. Have you spread your fingers out real stiff, that's very strong. Now that is overlaying into the nerve exam that we look for, and those are the intrinsic muscles. That's the ulnar nerve. If you have a bad ulnar nerve from here to here, it's going to give way and just fall away, and they'll be weak. Similarly, I want to look at your thenar strength and have you bring your thumb right up out of the palm like you're a good higher primate, and then push against me. And that's rock solid, and so we see this bulge up there. And so that tells us that your thenar muscle and your median nerve are working fine. Let's see what other common things. Something as simple, we didn't talk about this too much, but so common and ubiquitous are just sprained fingers. People jam their fingers. Baseball, softball, working out, whatever. And what's crazy is you sprain these joints, and we can palpate those, and we can test them. Some people tear them, but we test them, they feel fine, they're strong, but they're swollen, they're bulbous, they're tender, and that can take months and months to go away. So you just have to counsel people, your patients, my patients, to just be patient with it. Keep using them. There's no harm in using them. The cool thing about ligaments is they heal with motion, so we don't want to immobilize them too long. That's a common misperception. I see patients who have had bad sprains, even dislocations, and they're put into a splint. They come see me 3 weeks later, they're already stiff. I would move those immediately, maybe 1 to 2 days to rest them a little bit and then get them moving. Okay, so we've done, and remember, and well, you know this and not remember, but we were talking about the fact that we have the extrinsic tendons, both the extensors and the flexors, and those are muscles through here and then tendons through here all the way out to the fingertips. So we can isolate and find, let's say you have a little, you're cutting an avocado and you poke right in there. You have maybe numbness along here. We know you cut the digital nerve there, and this finger, when you make a fist, this one just stays up like that. And that tells me that there's something wrong with the tendon. Then I try to isolate that, say, well, can you bend the tip? And you say, oh yeah, I can bend the tip. But then I say, and that isolates the long flexor. Yeah. But then I do this, and you can't bend it, then that says, okay, you cut the superficial, one of the two tendons there. So it's really easy anatomically to figure these things out. I think that's about it. If you have it, we talked about the dinner fork deformity. If you have a distal radius fracture across here, it comes up here and goes this way. I mean, there's a true notable deformity. And so the population, with your help, is becoming younger and younger. And so we are more and more aggressive because there are 70, 80, 90-year-olds who are working out, who are playing sports, and we want to keep them going as long as possible, because I'm getting close to that. And so, so we fix those. We get them back. My mom was 82 when she broke her wrist, put a titanium plate on there, and you didn't even know that she had it. And she was using it 2 weeks later. So. Great.